Բարև ձեզ հարգելի բարեկամներ, Սուրբի ձայնը հեռուստահանդեսը դարձյալ ձեզ հետ է։ Այսօրվա մեր հաղորդումը ուզում եմ սկսել ձեզ ներկայացնելով հայ-ամերիկյան առողջապահական միության վերջերս տեղի ունեցած հավաքույթը։
Members of Armenian American Health Professional Organization AAHPO held a social and exceptionally educational evening and dinner at Biblos restaurant in New York. The event presented two distinguished medical professionals, Dr. John Bilezikian, Director of Metabolic Bone Diseases Program at Columbia University, and Richard Deckelbaum, Director of the Institute of Human Nutrition at Columbia Presbyterian Medical Center. Both speakers discussed the subject of improving healthcare in Armenia. In a family-style atmosphere, the event began with opening remarks by Dr. Larry Najarian, the president of AAHPO, who then asked each present guest to introduce themselves. Dr. Kimar Zumanyan introduced the first speaker, Dr. Richard Deckelbaum, who has long ties with Armenia and Armenian people and has been actively involved in working to improve the healthcare in Armenia, especially among children.
My affinity for Armenia goes back a very long way. It's been very special. And because of that, I want to bring to our attention that we really need to help Armenia. We need to help in terms of a very critical problem, which is the problems relating to nutrition, and I'll explain how that affects Armenia.
In an engaging and informative slide presentation, Dr. Deckelbaum spoke about the issue of malnutrition in Armenia, which often leads to stunting, a disorder that prevents children from growing or developing properly.
When I was approached by Dr. Hosepian to help with the nutrition problems in Armenia, the first thing I said is, I can't help sitting here in New York at Columbia University. I've got to go. And going there was just such an eye-opener that I realized that really there's huge problems. And the interesting thing is that there's an educated health professional group, there's a lot of educated people, so these problems are solvable, but they're not being solved yet.
Dr. John Bilezikian spoke in depth about several bone diseases prevalent in Armenia, including osteoporosis, a disease that had been until recently left neglected and untreated. He outlined the work he and his team have been doing in Armenia since many years and the progress that has been made so far.
Each of us is doing what we do best, and I think as we each do our best, that will have a multiplier effect, and together will actually have even a greater impact than any one of us can do.
He also made a special tribute to Dr. Edgar Hovsepian, who had inspired him to get involved in helping Armenia.
Thank you so much for this very interesting presentation. I'm from Armenia, so it was actually eye-opening for myself. Based on what I've heard from what you're saying, we're talking about a long period of time that you've been involved in Armenia. You basically started from zero, introducing a kind of disease that people were simply unaware of or didn't even care. And today, a huge progress has been made. What made you tackle this issue? Because clearly this is not just a one-time thing. This is something that touched your heart.
Yes. Well, thank you for your comments first. There are two things. One, obviously, it's my area of expertise. So I spent my whole career in metabolic bone disease. And so that was the given. Second, this idea that we diasporan Armenians may be able to contribute to our homeland and do it in a way that is beneficial, that doesn't ruffle feathers and make people suspicious. So it was kind of an experiment. The first year, I didn't know how it would go, but I was encouraged by that first visit. And then, as I mentioned, every year, a little more, and then 8 years later, you realize that you've had an impact.
The ending of your presentation was very important because you said more work needs to be done. Where are we and where are we going from this point on?
Yeah. Well, I didn't mean to suggest that we had come close to finishing. The areas that we've made progress in, we have to make more progress. For example, the DEXA machines. Yes, we're now average in the world, but we need more. Education. I still get questions from Armenian physicians that make me wonder sometimes, have they been listening? Repetition is the key to knowledge, so we have to keep going back. The issue of the government. You know, we as I mentioned, I think we have some of the ears. And then the last point, research is usually the sign of a very sophisticated scientific establishment. We have to do more of what we're doing, and it's going to take more time.
And money.
Yes, money, but I think you're absolutely right about money. And as we get more into this, it's going to cost even more money. But the other part of this is time. It takes time to do this, to organize these visits. You know, we start, in fact, I'm starting now for next October. So every day, not every day, but, you know, frequently, and I get my faculty together and have to raise the money myself. It's that kind of commitment that is required.
Well, I would like to thank you for that commitment, and thank you very much for today's presentation.
You're very welcome. Thank you.
It's not often that I meet such a fine young man who has not only traveled to Armenia, who has not only lived in Armenia, who has not only worked in Armenia, but who also speaks fluently Armenian. This is a true dedication. Before I ask you anything else, how did this happen?
Well, I got placed there for the Peace Corps, so I was in Armenia for 2 years, from 2009 to 11, where I met my beautiful wife. She is Armenian from Tavush. Since then, we've gone back and forth. We got married last year, and I got Armenian citizenship this year, and so we continue to go back and forth, and it's been great.
Wow, that's just wonderful. Tell me about your work there.
So I'm a medical student here in Columbia, and I teamed up with Dr. Bilizikian, who is an osteoporosis specialist here at Columbia, and he's done work in Armenia, and so he helped me organize a project looking into the risk factors for osteoporosis at the traumatology hospital in Yerevan. And so I spent 2 months there interviewing patients as they came into the hospital and working with local doctors to try to assess the risk factors for osteoporosis.
The event ended with an engaging and informative Q&A. After 20 years of community service, AAHPO continues its important humanitarian work in providing vital healthcare advice and assistance to our diaspora and Armenia.